that's a nice actually lead in, actually. The next question I had was just talking about the pros and cons of different kinds of lubricants, and what's good and bad about water-based, oil-based, and silicone-based lubes. So yeah, maybe Lorraine, can you start us off talking about that?
Yeah, I guess my understanding with the water-based is, yeah, it's all-purpose, and it works really well if you're using any sex toys within the sexual experience. And if there is any physical injuries, that maybe the sex toys may be a big part of their sexual experience, their sexual intimacy, and implementing pleasure. However, the downside, I would say, that it dries out quickly, more quickly than a silicone-based lube. With a silicone lube, you can be used with water as well as alongside the water base is all purpose, but you can use the silicone base with glass or metal toys, but not silicone based toys, because it would damage them. And so that's my understanding.
Yeah, it's something like if you have a silicone-based lube on a silicone other object that can tend to what, like congeal or something on the silicone, like almost like merge with it.
Yeah,
which is really weird. Something like that, Terminator.
Yeah.
It's not good, is it?
Yeah.
Okay.
No. And it damaged the toy.
Yeah. It's not exactly what
Don't
you
want that.
can't have that. More pros and cons. Jump in, folks.
Okay. For me, water-based lube, I've been doing some research on this recently, actually, that water-based lube that contains glycerin has a high sugar content, and that can cause a higher rate of yeast infection in women. So if you are going to use the water-based lube, it would be best to seek one without glycerin and certainly without sugar. But the pros are, as Lorraine said, it's cheap, they're very available. You can buy them for hardly anything in the pharmacy. In the UK, they're available on prescription. They're safe with condoms. The cons are sticky. It's not for me.
They don't tend to stain your sheets like.
That's true. Yeah, they don't stain fabric. Yeah. There was something else that came into my mind. Oh yeah, there are now hybrid lubes that use a water-based lube and silicone together. So yeah, that's all I've got to say on water-based lube. Anybody else?
If you're using oil-based lubes, right? It's also pretty likely to sort of stain things, your sheets, your clothes, and things like that. How do we should we just put towels down beneath this and stuff? We're using oil-based ones. What do we do in the oil-based situation?
I would always suggest that people, because working mainly with spinal cord injured people, often when they're choosing to be very intimate, sometimes there can be different bladder leakage and things like that. So quite often when I talk to people anyway, I'll talk about putting towels on the bed, or there are some fabulous sheets that you can get that are really washable, that you can throw down, that don't look like you're preparing to have sex all the time.
Right.
And they're just sheets that you can, and they're less slippy. So I would often recommend to put something down. It makes you feel freer.
And oil-based lubes can tend to damage latex condoms. Is that right?
Yeah.
Apologies if we mentioned that already. I don't think we did, but that's something that we should try and avoid, right? If we're going to use an oil-based lube, not to have a latex condom, but more of a polyurethane one. Is that correct?
Yeah.
Cool.
Yeah, they're not good with latex condoms. And the other thing to mention is about parabens. Parabens generally aren't great for health. So again, if you're using an oil-based lube, I would look for a paraben-free oil-based lube.
Okay.
I think the biggest problem, if I'm working with women who are postmenopausal, regardless of any other issue, then certainly with the water-based, they dry out really quickly. And what you don't want is something that dries out when you've already got a dry vagina.
And the water-based ones are more likely to do that quicker than others. Is that right?
Yeah, absolutely. Absolutely.
Gotcha.